Like many things in my life, it just happened by chance. I became a nurse practitioner after having been through a couple of careers. I actually was in school with 3 of my kiddos. We'll pay you to do some prerequisites to become a nurse. I'm on board. I'll give that nursing thing a try. I wanted to see them as whole people. I decided to go into part-time private practice because I could control how long I was with patients. If I needed an hour appointment, I could do an hour appointment. Create a business where employees feel cared about and they can be healthy. If employees are not healthy, they cannot provide good care to patients. The idea was nurse practitioner centered. People can work here for their lifetime and they can grow and change over time. Life happens. People's needs and wants change. And this practice is created to allow for that growth and change. It's okay to discover blind spots. It's okay to discover not doing something well, or you want to discover it. Fight it because it is there. The hard things are the things that are going to help you be a better leader. They're going to give you the most education and most understanding about yourself. Don't fight them. Just lean in and do it.
Welcome to Unsung, the podcast powered by Duet, where we shine a light on the nurse practitioners who are breaking barriers, redefining healthcare, and proving that NPs aren't just the future, we're the now. I'm Dr. E, and in each episode, we'll uncover the untold stories of NPs across the country who are changing lives with their practices, making a real impact in their communities. Meet Nicole Bennett, the powerhouse behind Willamette Health and Wellness in Portland. For over a decade, Nicole has built a thriving space where therapists and PMHNPs can do what they love, practice at their full potential. With 16 years as an NP, she's walked the walk, led her team through the chaos of COVID stronger than ever, and proved that when clinicians feel supported, whole communities win. Dr. Nicole Bennett, I'm so excited to have you here on the Duet Podcast.
I'm excited to be here.
Amazing. Okay, Nicole, before we even get to like the business part, tell us what made you decide to become a nurse practitioner.
Like many things in my life, it just happened by chance. I know that probably is not true for every nurse practitioner out there, but I became a nurse practitioner after having been through a couple of careers and having had 3 kids. I actually was in school with 3 of my kiddos and also working at Kaiser in medical research. And Kaiser sponsored a nursing program and said, hey, we'll pay you to to do some prerequisites to become a nurse. And I was like, hey, I'm on board. I'll give that nursing thing a try. And I always thought I was going to become a teacher. I thought, I really want to work with kids. I think I'll be a teacher. And at the same time, I was volunteering in my son's 1st grade class. And I'm like, oh my gosh, like, could never work with me.
JK.
One kid at a time, not 30. And someone said, hey, there's this thing called psych nurse practitioner and you can work with kids. And I was already in the RN program and I'm like, all right, let me look into it. And I discovered what a beautiful combination of thinking about somebody holistically, working in therapy, potentially medications. At the time, that wasn't quite as big a part of the role. But I'll talk to people, I'll look at it, I'll try it out. And I went forward and that's how I discovered it. And it's been lovely.
I don't feel like that's accidental. I feel like that's like the universe intervening.
Kind of wonder. Yeah.
Yeah.
And whatever it is, I'm happy it happened.
Whatever it is. I love that. Okay. So you became a psych nurse practitioner, which how many years ago was that? That's not as popular as it is today.
I did it. I graduated in 2009 with my master's. Yeah.
Am I right that it was not as popular back then as it is now?
Correct. Yeah. It was not.
So, okay. So it's kind of like really niche. And so what was your first job where like, you don't have to give names if you don't want to, but like what was the type of job there?
In terms of practice, actually this leads into the business ownership stuff too. So I focused on kids and I did most of my training inpatient in a child and adolescent psych unit. And then as I started exploring working outpatient with kiddos, I found that most people wanted nurse practitioners to be a prescription pad.
Interesting.
Short visits, med focus, not looking at the whole person.
You mean most employers?
Employers, yeah.
Okay.
Thank you for saying that.
Yeah.
Most employers wanted that. And that's what they were looking to hire. Contract, see kids.
15 minutes.
Yep. And I wanted to see them as whole people, and I wanted to see their families as whole systems. And contrary to, I think, what I might recommend now, I decided to go into part-time private practice because I
Mm.
could control how long I was with patients. If I needed an hour appointment, I could do an hour appointment. And then I worked at a community mental health center up across the border here in Oregon and Vancouver, Washington, with a group that I thought would let me be a nurse and see their kiddos. And so I did those two in the very beginning. So I started out my practice running my own business, which was a pretty big undertaking.
Wait, why would you say that you said I would not recommend it? Why would you not recommend that?
Well, it leads into one of your questions I'm sure you're going to ask me, which is why did I start a practice, more formalized practice, which is the current practice I'm running. It's isolating. And working with people helps us be better clinicians, and working
Oh, it's
alone in a
isolating
private
to have
practice.
your own spot.
Yeah, it
It
can
is.
be.
It
It can
is
be. Or it's
isolating.
a lot of work not to be isolated, which is what I did. I had consultation 3 to 4 times a week. I met with other peers. I did lots of training so I could collaborate with people. And it took a lot of energy to stay connected and to continue learning.
But you had these two, you said you still had your part-time job because a lot of our nurse practitioners who own their own practice
Hmm.
have the part-time job first. And
Hmm.
like very few like jump ship and go there. So they kind of put because they have
Yeah.
to still pay the bills.
Yeah.
So that wasn't enough to sustain that isolation, like having that part-time and then this, it still felt so isolating.
Not for me, because it was only 1 day a week in community mental health.
Oh, I
So it
see.
really was my main job.
Yeah.
Yeah.
You really bring up a good point. I know we have a million more questions to get to, but I don't
Yeah.
think we ever discussed on this podcast that isolation. And that is something
Mhm.
that 100% I grappled with. And
Mm.
until you suddenly eventually hire other clinicians, but that there's a big
Yeah.
window of time there. And I don't think we surfaced it, and it's really important for anyone listening that
Mhm.
that isolation is real. It's one of the,
Yeah.
thinking about it now, it's a great reason to be part of the Duet network because there's monthly meetings and it's like you can take as much as you want or as little as you want, but being connected is a big
Mhm.
deal. Oh, we should talk
And,
more about that.
you can be disconnected in an organization too, right? And
Absolutely.
I mean, as an owner of a practice that really focuses on making sure your people are connected, you know exactly what I'm talking about. And that was part of the vision of our practice was starting something where people could feel supported and connected. So I think that can happen anywhere. And it's sometimes hard to see until you've been in it a while. It's like, oh, I'm not connected in the ways I
Not
want to be.
connected.
But
Yeah.
yeah.
So you had this 1 day a week part-time and you started this
Hmm.
thing. But what was the reason that you started your practice? Like what inspired you to take the leap? Because you just want to see people holistically more time.
So that was just me, Nicole, doing private practice. I didn't really realize I was becoming a business owner.
Ah, yes,
I
the
was right. And so
accidental business.
I feel like I became a business owner when I opened this practice, when I opened Willamette, but I really was a business owner then. I just didn't realize it.
Yeah.
And I think that's probably true for a lot of people who do what I did. Yeah.
So you mean like just setting up like a shingle somewhere and just seeing patients didn't feel like a business because were you doing it at your house? Were you doing it like a space?
No, I rented an office that had other mental health providers who had spaces. And I thought, oh,
Mm,
here's a way to be in community with people, but we each were running our own thing. Why did I not think of it as a business? I don't think I thought of nurse practitioners as business owners. I just realized that I've never thought of that before.
ooh.
Yeah.
In that moment, you didn't think of it or?
I didn't. No, I don't think when I was opening that practice, that small business, I did not identify with being a business owner. I identified with being a clinician, and I had
Smart.
to do some stuff to be a clinician, and that stuff turned out to be business ownership.
This is big. I'm so glad we're surfacing this.
I'm
This
thrilled.
is it's so good because there's no question anyone listening to this is like, yes, yes, yes. Um, People, generally speaking, there are some outliers, but generally speaking, the type of person that goes to RN and then NP has not identifying, but they don't go into it to open up a business.
No.
They go into it to care, to take care, like of all the nursey things, and then they accidentally stumble into this for whatever reason. And there is an identity shift.
Oh
And
yeah.
there's also some friction points there because how do I take care, but also I need money? How do I charge?
Mhm.
Like there's this, we don't have to worry about charging people money when we're working for someone else.
Yeah.
And so that's, that is quite an evolution that I think everyone goes through. That
Mhm.
I'm so glad you surfaced it. Okay, so now you started this thing. Wait,
Mhm.
so wait, there's two parts I'm getting now. So you started this thing where it was kind of like this community space, but that wasn't a business. But then something happened. You're like, I'm doing the thing.
Yeah.
Why did you decide to do that?
Yeah. So I started this practice, Willamette Health and Wellness, with another nurse practitioner originally, and now run it on my own. But it started with us sort of standing in this community space. We each had our own individual practices and sort of looking at the space and realizing it wasn't community, that we were, and it was it was looking at a garbage can that nobody emptied. It was like, wait a minute, we're in the space together, but we're not working as a community.
Yeah.
We're not actually in the space together. We're people utilizing common space, but we're not in space together. It was sort of representative of that lack of community. And also, layered on top of wanting to be part of community is I had a 3 to 4 month wait list for patients. The other person I started the practice with had similar, and we were doing very much a holistic practice, and we liked the business. I think the business stuff was fun. I discovered that in that first year or two, and a lot of people don't like that. They don't want to do the business piece of it. And so how to create this vision of creating a space that had all of the things that a group practice, a bigger practice at the time, there weren't a lot of practices my size. They tended to be community mental health clinics or really big organizations through the major medical centers. How could we create a clinic that provided community, but also autonomy and being able to work to the full scope of your practice and having peers to get support from and providing mentorship, both peer-to-peer and other.
I think you're the only provider NP owner I know that the reason you opened the practice was to create a space for the providers.
Oh, interesting to hear.
It's really, really an interesting perspective. And, I'll tell you, most, myself included, like I discovered the team later. Like I opened up my practice for a particular type of patient. I felt that there was, yes, we took insurance, but I felt like we all know that there's this patient in the middle that does not qualify for clinic, does not have insurance, wants good quality care, and can afford like a $75, $85 visit. And we wanted to create a space. So that was like the initial mission. But then as the team grew, I was like, I became team-centric later. I also didn't have a team. It was just me and the wallpaper. But so the team came later, and it was evolution of the business owner into leadership. But you, and I imagine most people followed that. Like, I want to practice a certain way, and it's about the patient. And then but you opened up a place for the team in mind. Fascinating. It's very, very unique. So does that mean that from the beginning, you already hired people?
Yes. So we brought on 3 nurse practitioners in the beginning. So there were 5 of us to start with.
So everyone had their own panel? Because how do you afford to just start with 3 people?
Well, we both had 3 to 4 month wait lists.
Okay, so everybody had their own panel. That's the beauty of psych.
The 2 of us who started it had the wait list, and then we could just funnel that to the folks who were starting up.
Okay.
Yeah. Yep. And then, of course, our list of contacts and people who we'd worked with. And so they built their practice. The 3 clinicians we hired built their practice from our practice, essentially.
Wow.
And then their work going out and networking and who they knew when they were nurses and through school and all of that.
So when you started, what kept you up at night?
Things, how to figure out to get a phone system, how to.
That is so real.
I know. It's so fun. I think about what did I do on a Sunday afternoon? I had 3 kids, and on a Sunday afternoon, I'm working. What's the stuff that stressed me out enough to work on a Sunday afternoon? Really, what I think came clear to me, maybe that's the initial startup of the business, some of that structural stuff. But what really kept me up was figuring out how to be a leader. I mean, maybe business schools, but I met a lot of people who graduated from business schools, and I'm not so sure they teach you how to be a leader.
I do not.
What is this thing that I'm trying to do? And even recognizing that it is leadership, and even saying it's leadership felt strange and weird for a long time. It felt weird.
Feels not humble to say that at first.
Correct.
Until you realize you could lead with humility. But at first you're like, no.
Yeah. Leader means I think I'm better. Yeah. Right. All those things. Yeah.
Right. Very interesting.
And what do people want out of a leader, right? And worrying like, okay, do I have to know everything? Should I figure it all out? Should I ask them? I mean, what kept you up at night when you were learning your leadership? What were the big things that worried you?
Oh, well, first of all,
Yeah.
when I started, what kept me up at night was just being able to like pay the light bill. Leadership didn't come till later. I had no one to lead. It was just me.
Yeah.
Um,
Mm.
I had no one to lead, but that's why you kind of were thrust into it right from the beginning.
Yeah.
For me, that later it came, and
Mm.
I didn't do it very gracefully in the beginning. I could tell you that much.
Who does? I mean, that's just real, right?
Yeah, it's, yeah. It really is. So being this is good. I think while not every NP is a woman, majority are women, and I think in general there is a hesitancy around leadership. What does that look like? How do we do it without being seen as like, the B word, or thinking like, right? There's like a lot of like saying like, who does she think she is? And we have to learn how to lead. I think this is just my opinion. Learn how to lead almost into a certain type of feminine energy that is still very collaborative and uplifting. Because I think we have this vision of leadership that is hierarchical.
I was just going to say top down. That's a word that came in my mind right when you paused there. Yeah.
Yeah. And I think there's a different way to lead, but it takes time to figure that out. So that's what kept you up at night.
Yes, absolutely. Because I thought leadership was solving all the problems.
Ah, okay.
That would keep you up every night. That is not leadership, but that is what we think leadership is often.
Yeah.
And I did, at least.
And I wonder if that's also because our first role as leaders for many of us is being a mom. And we are expected to solve all our problems. We have all the answers. And so maybe that's this, we're trying to bring that skill set and we're like, that's not what works when we're with adults. I don't know. I'm
Don't you think there's a little bit of like nursing stuff in there about doing to be valid versus giving other people authority? I mean, I just think that idea of a nurse of like, you got to work hard, you got to be the hardest working. That drive is I think, I don't know now. I mean, obviously I haven't gone to school for a while, but I don't know if that's still instilled, but that's a big piece of nursing of like who we are and how we feel like we're good and valid.
And frontline and doing all the things. Yeah.
Yeah.
I agree with you. So it takes a lot of relearning and staying true. So what was like, this is a very different conversation because we're talking about early stages of leadership as opposed to early stages of the practice. So you did not have, because you came in with a waiting list, you didn't have some of the typical things I hear, which is like, we weren't sure how we're going to get patients. We weren't sure how we would,
Yeah.
So that's
there were those worries for sure. And faith. And I think you're right. You said something earlier about mental health. Unfortunately, we do well in hard times. It's an industry that's growing in ways that I wish it didn't. I wish we had a harder time finding patients. So that was not top worry. It certainly was present, but not top worry.
Wow. I love this so much. Have you changed the type of offerings in your practice, or is it like, I don't know, evolved clinically? Tell us.
Yeah. The idea was nurse practitioner centered. For two reasons. One I've already shared with you, which was the being able to work to the full scope of practice. That as in Oregon we had independent practice, as employers and people started identifying us for prescribing, our practice scope was getting narrowed in many of the jobs that we would look for. So thinking, how can we support NPs and psych NPs to be psych NPs and to do the work that psych NPs do so well? The second piece of the NP focus in the beginning was that there was a big gap between community mental health and primary care for behavioral health clients or clients who needed medication management. Basically, you time out of community or you get better enough to be kicked out of community mental health, and then you go to your primary care. And there wasn't really anything in between. It was hard to find that in between place for care when you needed more than a primary care provider to prescribe your meds. Plenty of people can be managed in primary care. I'm not at all saying that, but there is definitely a subset of people who have an illness that needs a specialty provider. 100%. And we wanted to provide that, and also wanted to provide medications for people who had therapists that they liked and not be stuck in a system. Because a lot of the systems here, you had to go to therapy to have access to a med provider within their system. So we focused on NPs first, but quickly we had two therapists who were like, hey, this seems kind of cool. Can we join what you're doing?
Oh,
And we're like,
wow.
well, yeah, let's try it out. Let's see how it goes. And so we added therapists, and now we're half, our clinical staff is exactly half and half. And then they've really, the clinicians have driven our expansion into many other things. So we've got groups now. We have DBT group, RODBT group. We've had a collaborative problem solving group
Tell
for
us
a
what
while.
DBT is.
Dialectical behavioral therapy. Sorry.
Nice. It's okay.
And collaborative problem solving, which is an approach for working with parents and families, kiddos who struggle. We had someone who just is working on trying some body work, yoga work with therapy. So she's building a group. We just hired somebody who's interested in doing environmental therapy. So part of the vision here, and I guess this comes back to what you were saying about creating a space for the clinicians, is that people can work here for their lifetime and they can grow and change over time, and their practice can grow and change over time. They don't have to sit in a room and do the same thing for 20 years, which nobody's going to do.
Yeah.
And that there's room within the practice for people to grow and to, maybe they start off seeing kiddos and they decide they want to start seeing adults with trauma, and that they develop into that role and they can change, or maybe they want to do therapy, or maybe they just want to do meds for a while. Life happens. People's needs and wants change, and this practice is created to allow for that growth and change for people who work here.
I love that. I mean, we do that also, we now have in the office 4 different NPs, and each one has their own spin-off. For example, I do not like to manage weight loss with medicine. It just does not fit my ethos. But the NP on Tuesdays loves to do that. And so I'm able to tell my patient who comes to me on a Monday, say, listen, I don't do this, and here's why. But that is just my opinion. And I would love for you to consult with my colleague who is wonderful and get her opinion. And then you can make an informed decision, as opposed to me telling you, either one of us leading, right? It makes the practice so much better. And one of my other providers is very interested in hormone replacement therapy. So we just recently sent her to, so you can, the beauty and the difference, right? I mean, the beauty and the difference. And now your patients have variations of treatment. It's so wonderful. It's wonderful for the NP, it's wonderful for the patient. And it's quite the opposite of working for a corporation, which is like, this is what we do.
That's right.
So that is great.
This is what we do. Now go do what we do.
Right. Now go do what we do, even if you don't like it.
Yes.
Even if you're like, I mean, there's some things you have to do, whatever, see X amount of patients or whatever.
Yeah.
But to be able to have a say and a nuance in how you practice, I think is so important. And, most of my NPs are part-time and they work in other places, and they say that what they love so much about working with us is that ability for them to shine, not to feel like they're part of a corporation. So I'm sure you have that with people full-time. So that's amazing.
Yeah.
So what's the master plan? What's the future goal?
You knew that was a trick question, didn't you?
I can't use any of the questions that I have on this thing for you.
So. And I studied them so hard for you. What is the master plan? The master plan is to continue having solid practice that is going to weather the storms that healthcare has brought us for all of our years of practice and is going to continue to bring us. So how to have a solid business model so that I can feel stable and the people who work here can feel stable, because we have 4 of us who've worked here for over 10 years, and we're about to celebrate 4 more people 10 years.
Wow.
And we have
big.
30, we have 36 people working here total, and that's a big proportion. And then we've got a bunch who are in the 5 to 7 year range. They need to feel good and solid about where they work, that it is not at risk. And to create a business where employees feel cared about and they can be healthy. Because if employees are not healthy, they cannot provide good care to patients, whether they're therapists, whether they're NPs, whether they're front desk staff, whether they're my biller. It doesn't matter who they are. They need to be healthy to provide good care and to give good customer service. And then we need to work on our patients being healthy. And if we can do all 3 of those things, that's done.
Easy. It sounds so easy to do. I'm not really sure why you're sweating. It's like, that's a Tuesday.
Yeah, right.
Make everyone healthy, give everyone security. No big deal.
No big deal.
No big
Yeah.
deal.
Sometimes I imagine the business this way, and I hadn't really thought about. I haven't shared this with you in the times we've talked before, but we're in a system that has some wonderful things and some super, super challenging things, right? This is the system of healthcare in America. And I like to think of this practice as sort of a buffer for the hard things about the system, for like trying to buffer it for the clinicians and the patients as much as we possibly can. Because it's hard. It's hard to navigate this system. It's hard to pay for the system. It's hard to figure out how to CPT code in the system. I mean, all those things. And that I try to have our administrative staff buffer that for the clinical providers so that they can provide the care that they need to provide. So even the way we've set up our business model, what insurances we take, so that we're not at risk anywhere, and that people can feel that security, because that's what we all need to do to be present for our patients, is to feel secure and grounded.
Yeah, I love that so much. I say something similar to my team, but more about the patient, where I'm like, listen, the patients, if it's so hard to be a patient, and the system is a system, and we operate in the system, but if we can just make this our experience that they're in our office somewhat better, then that was perfect, because we really can't change the system.
Nope.
So we try to buffer our patients for as much as possible. So we do
similar. Yeah.
Yeah. We do a lot of like weird things that primary care doesn't do. Like we have someone calling after every single appointment to say, like, not for reviews. Do like, did something, is everything good? Or like, oh, I didn't get my prescription. Oh, I didn't get my, so like they could, because that's the thing that will make it fall apart. They go home and then there's no, right. And that can just fall between the cracks just because clinician went on.
And it's a buffer for your clinicians too, right? It helps catch the things because they're so busy that they can miss as much as good as they're trying to do. So that's like a beautiful buffer for both of them. It's a good example. I'm going to write that down. I love it.
And it's additional resources, and it's a resource that you're spending without any return on investment directly. But indirectly, we're developing a tribe of patients who are never going to go anywhere else, because who does that?
Yep.
Nobody does that.
My vet does it.
Your vet does that. Okay.
I've never heard that in care of humans. I mean, I think that's wonderful.
Yeah. So it's these small things that we bring. I love that so much. All right, let's do some words of wisdom. What was the best piece of advice you've ever received about running your own practice?
The best advice, and this is only in the last couple of years, which I think is kind of interesting given how long I've been running a business. The hard things are the things that are going to help you be a better leader.
Oh,
I know. I wish someone had told me that earlier. And they're going to give you the most education, most understanding about your business, the most understanding about yourself. And don't fight them. Just lean in and do it. And I wish I hadn't fought so hard sometimes. I just, this mantra that the circumstance, the situation, the thing in front of you is a gift and an opportunity. And it's for me to figure out what that is, because it will be. In the moment, it sounds horrible. It sounds so hard, or it is hard. It feels hard. It's real. But looking back, 99.9%, you're going to find something that's like, wow, that hadn't happened, I wouldn't have.
100%. Did I almost cry when he said that? Maybe.
No, most. It's so true, right?
It's so true.
But it's hard to hold it in the moment.
It's so true. It's so true. I just said something very similar last night. Went out with our NPs, and I was telling, we had a very difficult clinician that eventually had to leave our practice. And no one knew that this was happening. But those months were so difficult. And I said to her, I said, but if I didn't have that, because of that situation, unfortunately, I discovered some blind spots that I didn't have. And I would never have discovered them.
Yes, absolutely.
Yeah. Yep. So,
and to be open to that, like that it's okay to discover blind spots. It's okay to discover not doing something well, or you could have been doing it differently, or people were unhappy. You want to discover it. This is my this is my advice now. Yeah. You want to discover it, invite it, because it is there. Whether you want to look at it or not, it is there.
If you think everything is good, you're missing something. Yeah. Not in a pessimistic way, but in
just real. And there's no way one person can understand everything. And if you get the group thinking and feeling safe thinking with you together, which means saying, hey, what about this? I wonder about that. Could we do this? This isn't working well for me. And if they learn how to do that in a healthy way, and you learn how to listen to it in a healthy way, it's not so much stress because you're not doing it alone.
Yeah. Oh my God,
It's
that's so
beautiful. It's a beautiful thing.
true.
And that is my offering to any business owner.
That's great advice, and like answered all my questions about what you would say to yourself. You can go back. That's the one piece of advice.
Yeah.
That's amazing. So, okay, now we're gonna just ask you some fun facts about you.
Oh, okay.
Okay. What's
I'm
a
ready.
fun or surprising fact about you that most patients or colleagues don't even know?
Yeah. When I was a little kid, I used to wear a bear bell on my parka to
A
go
what?
to the
A
school
what?
bus. A bear bell, because I grew up in Alaska
A bear
in the
bell. A bell for
woods.
bears.
Yep. And you put it on your zipper and it
Okay.
rings so that in the time where there's mama bears and baby bears, they know you're coming and they just run away and you don't get
See,
yourself
I'm
into
from New York,
trouble.
so these words don't even mean anything in English. So I'm trying to, okay, so bear bell. Okay.
A bear bell. Yes, it warns the bears so that,
And
yep.
you wore
So
it for the bears, or you wore it because you thought it was fashionable?
oh no, I wore it because I had to walk through the woods to get to the school bus on the
Oh,
highway up
okay.
the hill from my house through the woods.
Oh, wow.
I grew up without running water or electricity for a lot of my younger years.
No way.
Yeah, I did. Yeah.
So
That's my fun fact. It's a good one, huh?
it's a great fun fact.
Yeah.
Were you one of the first in your family to go for higher education?
Nope. Nope. My mom moved to Alaska and decided to live this life and took my sister and I
Oh,
with her, and we did it. Yeah.
okay.
Oh,
I'm loving that. So,
yeah.
okay. And if you weren't an NP, what would you be doing?
If I weren't an NP, I think I would be doing something in education.
Mm.
So I taught at OHSU, which is our medical school here, for 8 years in the first 8 years of this practice, which was a lot. But I loved teaching. I loved teaching. It just got hard to do all of it at one time. So even though I said in the beginning I didn't want to teach 30 kids, I might not want to teach 30 kids, but I could teach 30 adults.
30 adults, yeah. I still teach in spring semester here locally, and I literally have no time for it, yet I love it so much.
Mm-hmm.
Yeah. And like, it's definitely not for the money.
No.
The amount of time you put into it is definitely not for the money.
No, absolutely not.
Okay. What's a fun or unexpected hobby you enjoy outside your practice?
Well, I'm going to tell you my 2 new hobbies I'm super excited about.
Tell me.
So, one, I got a pedal assist electric bike this summer or this spring, and I've been biking to work.
Nice.
I had no idea how much I would love it. I drive along the river here in Portland. I don't know if you've ever been to Portland, and there's this river walk, and you can buy it's wonderful. The other thing I did, I've always wanted to learn how to scull.
To what?
Like row? Skull,
Oh,
row.
row.
Mhm.
Again,
Yeah.
from the city. I need
Come on,
words.
there's rivers in it. Come
No, but I never heard that word. Maybe I'm just dumb. I don't like that's a possibility.
So I've always wanted to learn how to row, like boys in the boat, like rowing on the Charles in Boston. You see people on the river here doing it. For some reason, it just entices me. So I took a class in what was it, May for beginners, adults, to learn how to scull. And I have to tell you, this is a bit of business advice, along with just telling you something
Let's
about me.
go.
Doing something brand new where you just like take yourself out of this leadership role, people looking to you to answer questions, a sense of authority or comfort, and just go do something totally new. It is so informative and useful to be a learner and to remember how vulnerable it is to be a learner. And this class was just so fun for me. I've done it in other ways. I tried to learn Spanish a couple of years ago, and not a fun place for me to be a learner, but just putting myself in that environment of like, I've never been in a boat before. I've never sculled. I don't know the language. They say all these fancy things when you lift the boat out of the water and when you're supposed to stop and go. And I can't remember the sides of the boat. To be a true learner is one of the best things I can do as a leader. And I have so much fun doing it.
I cannot tell you how much that resonates because I I swim with my wife, and I'm not a great swimmer. She's a great swimmer.
Mm-hmm.
And so I had to teach myself certain strokes, which I found extremely difficult to do because you're like gasping for air. And it was like horrible because I'm a fit person, but I couldn't even get like through half a lane and then eventually a full lane. And now I could do it, no problem. It took me a long time. But I'm constantly using that in my everyday. I'm like, listen, you learn how to do this. You can learn how to do this. It's hard in the beginning. You will get through it. And because it's the same process, right? All over and over again.
Absolutely.
Yeah. So putting yourself in that, I agree with you. I translate that all the time to business.
And the idea of being comfortable with that learning process, and you used this word earlier, and I'm a big fan of Adam Grant and rethinking, that idea of like being willing to go, oh, wait, I have a blind spot. I'm gonna relearn this thing I thought I knew, and to feel comfortable doing that's a process and that's normal. It's not a gap. It's not a failing on your part. That's what it makes this job doable without crushing me and keeping me up at night, is that I have comfort with that after all these years. And so I know there's blind spots. I just feel pretty confident they're going to come forward because I have a culture here where people bring it forward.
Yes, I agree. And so it's like, people say get comfortable with the uncomfortable, but it's almost a step further where it's like, it's not even uncomfortable. It's like, it's what it's supposed to be. And if you're an entrepreneur, because a lot of times the younger practices just starting out, they have this mindset of like, well, as soon as I get this straightened out, it's going to be okay. And I'm like, no, sis. It's never going to be okay. And you're never straightening it out. This is a never ending process.
Yep. It is the work.
It is the work. It is the work. And so, and I'm like, quickly get rid of that language because you're going to be so frustrated.
Yeah. And burn out. Because there isn't that end.
There's an end.
All. Mm-hmm. Absolutely.
That is so true.
Yeah.
That is so true. So time out a second, whoever's editing this, because I'm going to say goodbye to you, but don't actually don't actually leave.
Okay.
This was amazing advice. Nicole Bennett, I am so glad you were on this podcast. Thank you for being here.
I appreciate you inviting me. This was fun.
That's a wrap for today's episode of Unsung. If this inspired you, share it with another NP who needs to hear it. Don't forget to subscribe and leave a review. It helps more NPs find us and fuels the movement. Want to join the largest NP practice network? Learn more about Duet on our website, joinduet.com. Until next time, keep pushing boundaries and proving what NPs can do.